Welcome to the explainer. During a difficult labor, time is absolutely critical. When there's a chance a baby might be in distress, doctors can't afford to guess. They need answers, and they need them fast. Today, we're breaking down fetal blood sampling, which is the procedure that gives them a direct, real-time look at a baby's well-being in those crucial moments. So let's start with a really important question that, many parents might find themselves facing. When labor just isn't going as planned, how can doctors get a truly accurate check on the baby's condition right then and there? All right, here's how we're going to walk through this. We'll start with the critical moment this is all needed. Then we'll look at the specialist's toolkit, go through the procedures step by step, talk about why getting the perfect sample is so important, and finally, see how that sample leads to safety. Okay, let's dive into that first part, a critical moment in labor. In these high-stakes situations, there's just no room for guesswork. Doctors need hard data, and they need it now. And the solution is a procedure called fetal blood sampling. It's essentially a way to give doctors a direct window into the baby's health. By taking just a tiny drop of blood, they can analyze things like oxygen levels, which tells them immediately if the baby is doing fine or if they're in distress. Now, you can imagine performing such a delicate task requires a very specific set of tools. It's not something you can just improvise. It all comes together in one highly specialized kit. And what's really amazing is that everything needed comes in a single sterile package. I mean, everything. These kits have actually been developed and refined since 1995, working directly with the companies that make the blood gas analyzers to make sure every single component works together perfectly. Okay, first up is the amnioscope. Think of this as the doctor's window. It's gently inserted to get a clear, totally unobstructed view of the baby's scalp. And to make sure visibility is perfect, every kit even comes with its own little disposable light source that just clips right on. Pretty clever. Next is the sampling wand. And this thing is just a brilliant piece of design. It's a multi-tool. It holds a tiny, specially angled blade to make the puncture, but it also holds the capillary tube that's used to collect the blood. It does it all in one instrument. And this little glass tube, this is the real key to collection. It uses a cool bit of physics called capillary action to just suck the blood up quickly and efficiently. And that's absolutely vital, because you have to get that sample before it has any chance to clot. So, we've seen the tools. How do they all come together? Well, it's a sequence of really careful, really precise actions. Let's walk through it. The whole sequence is just meticulous. First, the amnioscope goes in to get that clear view. Then, they apply a thin layer of petroleum jelly. Now, this is a super clever, kind of low-tech trick. It creates a waterproof surface that helps a perfect little bead of blood form instead of just spreading out. After the tiny puncture, the blade is immediately retracted for safety, and the capillary tube is moved right in to collect the sample, all in one smooth, efficient motion. But just getting the blood is only half the battle. The quality of that tiny little sample is absolutely critical for what comes next, because the machines that analyze it are incredibly precise. Here's a good way to think about it. You can have the most advanced piece of diagnostic technology in the world, but it has one major requirement. It needs a perfect, uniform sample to give you a reliable result. Any little imperfection can throw the whole reading off. So for the analyzer to even accept the sample, it has to be perfect. And that means completely filled, zero air bubbles, and no clots. Anything less, if it's slightly underfilled or has the tiniest air bubble, the machine will just flat out reject it. And getting a bad sample isn't just a minor issue. In fact, it's the single most common reason for a failed analysis. And a failure doesn't just mean a delay. It means that entire delicate procedure has to be done all over again. All right, so let's say they've done it. They've got that perfect sample. The clock starts ticking to turn that tiny drop of blood into a critical, life-saving decision. And there is no delay here. The second that capillary tube is filled, it's carefully capped on both ends to protect it. Then it's rushed immediately over to the blood gas analyzer, which can give a result very, very quickly. And that is the real payoff. This entire incredibly delicate procedure, it all boils down to one thing: giving the medical team a clear, data-driven answer. It tells them if the baby's okay and labor can continue, or if they need to step in right away for a safe delivery. It really makes you think, doesn't it? This whole procedure is basically micro-testing done under enormous pressure. So as our diagnostic technology gets even smaller, even faster, you have to wonder, what's next?
What other areas of medicine could be totally transformed by this kind of real-time analysis?